the dose calculation, we are concerned, you should know, you should memorize, you should understand this point that for going to calculate the doses, you have to look the strength, not to the total volume in that container. Bismillahirrahmanirrahim. This is Sayyid Mubashir and welcome to my YouTube channel, the EV Pharmacology, and my Facebook page, Dr. Sayyid Mubashir Official. So today I am here with a new lecture, the part 2 on the dose calculation. My previous lecture was on IV fluids and was on the drip rate and so on. The contents are there. So in the continuity of that lecture, the part 2 is will be discussed today. Today, what I want to discuss that is dose calculation, especially regarding the injectable dosage forms and the patient regarding the pediatric patients. So let us start. Bismillahirrahmanirrahim. Sallallahu ala Muhammadin wa alihi wasallam. The today's contents are dose calculation. Okay, but for pediatric patients. Okay, dose calculations for pediatric patients, and especially for which dosage forms? Injectable. Okay, so many students face different issues how to calculate the dose, especially for injectables, IV dosage forms, and regarding the pediatric patient. So today I will try my best to make the concept clear. So for calculating the doses for injectable dosage forms and for pediatric patients, the first thing which the students should know and should memorize and should do, that is one thing, जो injectable dosage forms हैं, that are available in different forms, like that might be available in solution forms. Okay, solutions, already made solutions could be there, and they might be available in powder form, and you know this very well. The injectable dosage forms are available either in solution form or in powder form. Okay, and they might be available in different containers, like the container might be a vial, the container might be an ampoule, and so on, and they are available in different volumes. Okay, if solution, let's suppose if there is the solution and that is the ampoule, so you know that, let's suppose there is a drug ABC. Okay, let's suppose this is one of the drug and this is available in ampoule. Okay, and the volume of ampoule is, let's suppose, 2 ml. You know these things very well. The injectables, okay, they might be available in solution forms, or they might be available in powder form, they might be available in vials or ampoules or any suitable container, and with different volumes. So if there is a drug ABC and it is contained in ampoule and the total volume of ampoule is 2 ml, but along with this side, you know that there is strength mentioned on that ampoule or that container, any dosage form, any container, the strength is mentioned. For today's content, what the important point is that strength. You should know that what the strength is mentioned on that container, a specific container, a specific vial or ampoule. So from your experience, I think this might have passed that you might have seen that let's suppose it is written on that the container or the label of the container 2 milligram per 1 ml. Okay, this is what strength. There are two things. You should know these two things, the difference between these two things. One thing is the total volume contained in that container. This is something else, okay? And the other thing is the strength. And what does mean by strength? Means a specific quantity of the drug or the specific quantity of the active ingredient contained in a specific volume, a specific vehicle, a specific quantity of the vehicle, a specific quantity of the vehicle. So that is known as a strength. So there are two things. Let's suppose the ampoule. I'm giving you the example from this one. Okay, you might understand from this one. This is one of the syrup. Okay, I'm not telling the specific name of that one. So in this is a bottle of a syrup. This is not for injectable, but this is for oral. But for explaining the point what I want to discuss here, there are two things. Number one, this is a container, this is a bottle of a syrup. Okay, so here two things are written over there. Number one, I'm closing this to the camera. This is actually total quantity of the syrup contained in this bottle is 60 milliliter. Matlab total volume of the syrup in this bottle is 60 milliliter. This is one thing. The second thing written on the syrup is that each 5 ml contains that drug 125 milligram. So this is known as a strength. The strength is something else. Total volume contained in that container is something else. So there are two things. So regarding the dose calculation, we are concerned, you should know, you should memorize, you should understand this point that for going to calculate the doses, you have to look the strength, not to the total volume in that container. Any container, it might be ampoule, it might be vial, it might be bottle, any container. And what is the total volume in that container? We are not concerned with that one. The total volume contained in that one, in that container. For going to calculation, we are not concerned with that total volume. But we are concerned with what? We are concerned with the strength mentioned on the label of that container. And what is the strength? The specific quantity of active ingredient or drug in a specific quantity of the vehicle. So let's suppose on this bottle of the syrup, it is written that each 5 ml contains 125 milligram of the drug. So this is the strength. Means if we will take 5 ml from this bottle, so that 5 ml will contain how much drug? 125 milligram. This is the point which we are concerned with. Okay, so for calculating, we are concerned with the strength, but with not the total volume. So let's suppose the ampoule's total volume quantity is 2 ml. Let's suppose 5 ml. Okay, 5 ml. 5 ml ampoule's total volume, total quantity. And the strength mentioned on that ampoule is 2 milligram of drug in 1 ml. 2 milligram of drug in 1 ml. So this might be situation over there. So if this is the situation, we are concerned with this strength. We are not concerned with the total volume in that ampoule. But usually regarding the ampoules, this is not the situation. What the situation is over there? Let's suppose the total volume of ampoule, let's suppose is 2 ml. And also the strength mentioned over there, that might be, let's suppose by 2 milligram of drug in 2 ml. This might be situation over there. Okay, because already in the ampoule is containing very little quantity of the total volume. So before going to dose calculation, these are basic points which we should know, that for calculation of the doses, we will look on the strength, not on the total volume. Okay, and this is one thing. The second thing which you have to do, that let's suppose there is a drug 65 milligram in 5 ml, or 60, let's suppose 60 milligram in 5 ml. This is the strength mentioned on the label of that container. It might be ampoule, it might be vial, it might be any suitable container. We are not concerned with the total volume, but we are concerned with the strength. And let's suppose this is the situation, this is the statement of the strength written on the label of that container. Okay, 60 milligram of the drug is contained in 5 ml. Okay, let's suppose that is ampoule. Now what you have to do before calculation, the first step, I'm going to make it very easy, make the calculation very easy. From basic, what you have to do, you have to leave the total quantity on side, but you have to look at the strength of that container. Okay, this is your first step. The second step, what you will do, that you have to do that if this is the situation, 60 milligram of the drug in 5 ml, or 60 in 10 ml. Let's suppose this is the strength mentioned over there. Okay, first thing which you have to calculate, that you have to calculate that how much drug will be contained in 1 ml. You have to calculate from the strength, from the statement of the strength, you have to calculate that in 1 ml how much drug will be present. So what do you see from this statement? 60 milligram in 10 ml. Okay, so how much milligram will be present in 1 ml? So obviously if you will divide 60 with 10, obviously there will be 6 milligram of drug per 1 ml. The first step to start the calculation regarding the injectables, okay, the first step of calculation which you have to do to simplify the calculation, you have to calculate that in 1 ml how much drug will be present. Okay, so in this situation 6 milligram will be in 1 ml, but from this situation you have calculated this one, but if already the strength available that might be 60 milligram in 1 ml, this might be the already made situation over there, this might be the situation over there, there is 60 milligram of drug in 1 ml. So in this situation there is no need to do this step, because already in 1 ml there is 60 milligram. But if there is like this situation 5 ml or 10 ml or any volume of that, so from that you have to come to this step. Okay, you have to calculate that in 1 ml how much drug will be contained. Why you are going to do this one? Because now we are coming on that situation. Why we have done this one? Let's suppose a doctor prescribes, we are coming on a problem or exercise. Let's suppose a doctor prescribes for a patient the dose of any drug. Let's suppose the doctor says that you have to give the dose of, let's suppose the drug is A, B, C, okay, and the doctor prescribes that you have to give 5 milligram of dose to the patient. Okay, 5 milligram of the dose to the patient, and in ampoule the drug is available as 2 milligram per 1 ml or 2 milligram per 2 ml. Let's suppose this is the dosage form or strength available in ampoule. This is the drug ABC. This is the available, okay, and the doctor's prescription says this one, 5 milligram of the dose to the patient, okay. This is the prescribing order of the doctor, and this is the availability. The step you have taken previously, that you have to calculate that in 1 ml how much drug will be present. So from this situation, 1 ml will be containing 1 milligram, okay. 1 ml will be containing 1 milligram. So this is the point which we will calculate. In order to put this value, we will divide the given dose of the drug. We will divide this given dose of the drug prescribed by the doctor. We will divide this value by this value, 1 milligram. We have calculated this value, okay, in order to divide the prescribed dose. Let's suppose the prescribed dose is 5 milligram, okay. So this dose will be divided by which value? From this value which you have previously taken. So in this situation, obviously there will be the same thing, 5 milligram, okay, sorry, 5. From this calculation, the value will be 5. So what does this 5? This is 5 ml. This is 5 ml because the drug is available in solution form and ml form, okay. So if we will give 5 ml, so it will deliver 5 milligram because the prescribed dose is in milligram, but the available drug is in ml form, okay, in ml. Available drug is in ml, okay. Injectables are available in ml, but the doctor has prescribed the dose in milligram, okay. So for calculating that how much ml should be given to deliver 5 milligram of the dose, from this ampoule, how much ml of that ampoule should be given to that patient, so that the patient may get this prescribed milligram. So for calculation that scenario, we are going through these steps. Number one step, that you have to calculate that 1 ml will be containing how much drug. So the value of that drug will be taken here, and we will divide the prescribed dose of the drug by the doctor with the value taken from here, okay. So in this situation, if you will divide 5 milligram with 1 milligram, obviously the answer will be 5. Now what is this 5? This is 5 ml. So if you will inject 5 ml, okay, then you may be able to deliver 5 milligram. But here in this situation, the ampoule is of 2 ml, means there is a need of one more ampoule and 1.5 more ampoule, because this ampoule is total 2 ml. So you have to give the second ampoule of 2 ml, that will be 4 ml, and even 1/2 of even third ampoule to make the volume 5 ml and to inject to the patient to give the dose of 5 milligram. So this is the simplest way to know how to calculate the injectables. I am quoting here one more example. Let's suppose there is a drug Ceftriaxone, okay, and you know that Ceftriaxone is one of the broad spectrum, okay. This is the cephalosporin drug, okay, and this is the third generation drug, and this is indicated in so many conditions, like this can be given in acute bacterial otitis media. This can be given in gastrointestinal infections, and this can be given in gonococcal infections. This can be given in meningitis, okay, and few other conditions. This Ceftriaxone has been prescribed and recommended, even in prophylaxis of the surgery. So there are many situations in which Ceftriaxone can be given, okay, and also it can be given to the pediatric patients. So by today's lecture is the dose calculation regarding the pediatric patients. So let's suppose the drug is ceftriaxone, and ceftriaxone regarding the pediatric patient, this is available in solution form also and also in powder form. Solution form में भी है and powder form में भी है. I'm quoting as example of Medscape. Medscape is one of the application, one of the standard reference which has been used by different doctors to prescribe the medicine for the patients. Okay, so ceftriaxone for pediatric patients, ceftriaxone is available in injectables form. Okay, also this is available in oral form, also in elixirs form. Okay, but I'm talking about the injectables. Ceftriaxone medicine for pediatric patients, dosage form is injectable, and this is available in solution form also, and this is also in powder form. In solution form, this is available as 1 gram, okay, and also 2 gram, but per 50 ml. Per 50 ml. I'm writing here 1 gram per 50 ml, and also 2 gram per 50 ml. This is the available strength of the ceftriaxone in solution form. Okay, 1 gram per 50 ml and 2 gram per 50 ml. And also this is available in powder form. In powder form, this is available in 250 milligram powder, 500 milligram powder per vial. जो भी vial है उसका size जो भी है 500 milligram, even 1 gram, also 2 gram. These are the 4 strength per vial in powdered form. Ceftriaxone for pediatric patients, this is the situation. Okay, there is a patient, a child patient, and he's suffering from let's suppose meningitis. So in meningitis for a child patient, the recommended dose of ceftriaxone is 100 milligram per kg per day. This is the recommended dose, 100 milligram per kg per day. Okay, this is recommended dose of ceftriaxone for a child patient in which disease meningitis. This is the recommended dose. So obviously you know very well that this is 100 milligram per kg. If the patient's weight is 1 kg, you can give 100 milligram in whole day. But let's suppose for doing this calculation, let's take an example. The patient's weight is, let's suppose, 7 kg. Okay, so in this situation, this 100 milligram will be multiplied with 7 kg weight of the patient. So obviously total quantity will be 700 milligram per whole day. Means in 24 hours you can give 700 milligram of ceftriaxone to a child patient. Okay, in which situation? Meningitis. Okay, now you have to give 700 milligram per day, and now you have the available strength in solution form 1 gram per 50 ml and 2 gram per 50 ml. So from this situation the total dose is 700 milligram. So we can take this strength because this is containing 1 gram, means this is 1000 milligram per 50 ml. Means we can take this ampule or this vial to be used for this patient, because the patient's total dose is 700 milligram and this is containing 1000 milligram. So this can be used for this patient. Okay, so what is the step you have to do? I am doing this one. 1 gram per 50 ml. This is the strength available. 1 gram means 1000 milligram per 50 ml. Okay. Now the first step which you have to do that in 1 ml. In 1 ml, how much drug is available? This is 50 ml. And 50 ml, 1000 milligram are there. Means if you will calculate 1000 by 50, there will be 20. Means 20 milligram of the drug will be contained in 1 ml. This is the first step which you have to do. Okay. Now up to this you can come to know that in 1 ml total 20 milligram drug is present. Now what the second step is, what you have to take this, the total dose 700 milligram. This is the total dose that should be given to the patient, to a child patient. Now you have to divide this total dose with this quantity which you have calculated, 20. Okay, 35 ml. So the answer is 35 ml. The available is 1000 milligram in 50 ml. This is the total volume available in that container. If we will take 35 ml from this, okay, this is total 50 ml, but if we will draw 35 ml from this ampoule or from this vial, you can deliver how much? 700 milligram dose to that pediatric patient, to that child patient. So this is the overall calculation about this situation. But I want to quote one more example, one extra example in that situation. Okay. In this example which I am going to quote, the situation might be difficult for students. Let's suppose there is a drug phenobarbital. Okay, there is a drug phenobarbital. You know that this is a barbiturate and anticonvulsant medicine, and this is also given to the pediatric patients. Even in neonate patients it can be given. So phenobarbital medicine is there, and this can be given to neonates. Let's suppose less than 28 days of age. Okay, neonates, this can be given in neonates. In which situation? In seizures. Okay, in seizures phenobarbital can be given to neonates. In which situation? Seizures. And the recommended dose is 3 to 5 milligram per kg per day. This is the recommended dose of phenobarbital for neonates. In which situation? Seizures. But the strengths available of phenobarbital as per the reference of Medscape, that is 65 milligram per 1 ml. This is one strength. Other strength is 130 milligram per 1 ml. This is solution form. In solution form, phenobarbital is available in 65 milligram per 1 ml. It might be ampoule, and also 130 milligram per 1 ml in solution forms. And this can be given to the neonates, okay, and seizures, and the recommended dose is 3 to 5 milligram per kg per day. So this is the scenario. Now let's suppose the patient's weight, because this is already neonate, less than 28 days of the age. Let's suppose the patient weight is 2 kg. Okay, patient weight is 2 kg. Now let's suppose we are recommending this 5 milligram, because from 3 to 5, let's suppose we are recommending 5 milligram. So 5 milligram into 2 kg. Okay, this will be total 10 milligram dose per whole day. The total dose is 10 milligram. The 10 milligram is the total dose which can be given to that child, okay, per whole day. But the phenobarbital is available in 65 milligram per 1 ml. Here already the situation is what which we have to do. The first step which we should take, which is step that we have to calculate that in 1 ml how much drug will be containing. But here the available strength is already in 1 ml. So here there is no need to take this step of calculation, because already the ampoule is containing 1 ml 65 milligram. The second step is what? We have to divide this dose with the value of the drug contained in 1 ml. So let's suppose the dose is 10 milligram, okay, and if we are taking this vial, there are two situations available. Let's suppose we haven't available this one, only we have available at our any setup, hospital setup. Let's suppose this vial is available. So obviously 65 milligram is 1 ml. So we will put this value at this place. Now if you will divide 10 milligram with 65, I think this will give 0.15. I think this will be the value. Now this is the value, but this is ml, means 1 ml is containing 65 milligram, but we have to give how much dose? 10 milligram. Okay, 65 milligram is contained in 1 ml, but the dose is 10 milligram. So how much ml should be taken? From calculation we came to know that if we will take 0.15 ml, okay, and if 0.15 ml we will inject to the patient, to the child patient, to the neonate or neonate, so we can deliver 10 milligram of the dose, because 10 milligram of dose is calculated from this recommended dose. The recommended dose is 3 to 5 milligram per kg. Patient's weight is 2 kg. So from this scenario, what we came to know that the recommended dose now for that patient will be 10 milligram. Okay, so 10 milligram, for giving 10 milligram we will give 0.15 ml. But here the situation that for we practically point of, this is the theoretical point of view, but practically point of view, I think this might be quite difficult to draw 0.15 ml in any syringe. I don't think so that there could be any syringe which can draw, that might be, but might not be any syringe over there which can draw 0.15 ml of the solution from that ampoule and inject to the patient. So here regarding the calculation point of view, this is quite difficult. Theoretically you have calculated, but practically you can't do. So for easiness of practical point of view, what you will modify this calculation, you will modify in this situation that what you will do, let's suppose the available strength is 65 milligram per 1 ml. Okay, if this is the situation, so the answer is 0.15 ml, and this is quite difficult to draw such amount, such volume in a syringe. So what you will do, you will dilute this one, this, the available strength, you will dilute. Okay, you will dilute 65 milligram. This is available in 1 ml, so obviously you can dilute it with, let's suppose, 10 ml. Okay, you will draw this 1 ml from that ampoule and you will dilute, you will add much more water for injection and any suitable solvent over there. Let's suppose you are diluting with 10 ml. Now the situation will be, here the situation is what, 65 milligram in 1 ml, and now you have diluted up to 10 ml. So the situation is 65 milligram now in 10 ml. Now the total volume is 10. Here the total volume is 1 ml. And 1 ml 65 milligram. But you have diluted with 10 ml. Water for injection. Water for injection. Now the situation is what? 65 milligram of drug is contained in 10 ml total. Okay. Now here you will take the same first step. which is step. Now here the situation is what? 10 ml is containing 65 milligram, but 1 ml will be containing how much milligram? Obviously, if you will divide 65 with 10, so the answer will be 6.5 milligram. Oh, sorry, 6.5. Okay, so 6.5 milligram will be in 1 ml, and this is our required step. We have to calculate that in 1 ml how much milligram will be containing 6.5. Now here the situation will be, now here 6.5 milligram in 1 ml. So this is the value. You will divide the recommended dose, and the recommended dose for that patient was 10 milligram. Okay, because recommended dose was 3 to 5 milligram per kg, and the patient's weight was 2 kg, so the conclusive dose was 10 milligram. Okay, for that neonate. So this is a 10 milligram total dose recommended for that patient. You will divide this now with this value, because now in 1 ml the total milligram was 6.5. Here the situation was, the first situation was, you were dividing 10 milligram dose with 65, but here you are dividing with 6.5. This is the small amount, this is the large amount. If you were dividing with large amount, the situation was this one, but here this is a small amount, so obviously the value will be, now the value will be 1.5. Okay, 1.5 ml. So now in this situation, it is not difficult to draw 1.5 ml from that ampule and to inject that patient. So this was all about the dose calculation of the injectable dosage forms for pediatric patients. I have quoted two drugs, Ceftriaxone and Phenobarbital, and both situations I have discussed. If the situation is easy, then directly you can do that one, but if the situation becomes like this one, when the situation becomes quite difficult to draw, you can dilute, okay, the given strength of that ampule. The given strength is 65 milligram per 1 ml. You can dilute in any quantity. Here I have written 10. You can, if even after this situation, after diluting with 10 ml and calculation, the conclusive answer is 1.5. Let's suppose even at this situation you are unable to draw 1.5 ml, then even you can further dilute this one. You can do that one. So this was all about for dose calculation of pediatric patients regarding the injectables. Hope so that you have got the points, and this might be helpful for you people in many competitive exams, and inshallah further more lectures will be uploaded regarding the dose calculation of oral dosage forms also. And till that, Allah Hafiz.